Arting for Health actually brings together young artists, street artists in specific, and scientists together. These are unusual people that you can find working together. So Arting for Health intention was to bring artists, street artists, and scientists together to try to explore what happens when these two people meet. But the underlying factor, it should be about, and it's an engagement project simply, to try to take the message out to people on these biomedical subjects, complex biomedical subjects, in such a way that it's relatable,
Started with a dream, now I got a team. My whole family couldn't see what I mean. Stuck my neck out, features in magazines, newspaper articles, talking shit I never seen. For the rap and the paint, I'ma keep it evergreen. Kept the grounds cultivated ever since I was a teen. Who wanna tell me they ain't know the role I played? Had a city on my way before you press play. Catch a clue.
Artists are interesting people. I think they also see us as scientists as interesting people. I hope they do as well. And I did indeed recognize that we have different ways of thinking. So for me, I'll be thinking we go to a place, we measure people's blood pressures, they sit down, we tell them your blood pressure is either normal or it's high. If it's high, this is what you have to do. And the artist will be thinking, well, how else can we attract more people? How do we make this more lively? How do we make this more fun? So from that sense, it added a really different, interesting angle to the study.
We had, a skill share exchange project between scientists and artists, and it was really to make us a little bit more aware of what these I can't even call it socio-economic issues, but like what it means to contract HIV and AIDS and live with it. What it means to not take care of your body and end up having, like lifestyle diseases like hypertension. What it is to deal with mental health.
It's an engagement project that brings together these people in an effort to collaboratively work together and sending out the message to the people in such a simple and engaging way that would eventually spark the dialogue within the public spaces.
Be the one my sons look to. Be there, street smarts in the books too. Go camping like my dad always did. Do things.
It was a wonderful experience because we were with Rafilwe, and she is just a really fantastic, young, vivacious, really almost graphic artist. And it was fabulous because, sometimes doctors can become quite insular, and she was completely from another world, and she really didn't even have much background into biology. So she asked me my very favorite question of 2018, which was, do cells have heads? And I thought, wow, this is really great, because sometimes we make assumptions about the public that they know a lot more than sometimes they do. And so her questions really helped me to start to change my narrative so that it makes sense to people and it's not just scientific gobbledygook. And so working with her was fabulous because she saw things so completely differently than I did. And then to actually see the product of what she was able to come up with in just 5 days was just a wonderful experience, very, very inspirational.
For me to do that artwork, normally when you see artworks about AIDS, they're very scary in a way. The message is not quite positive, it's always negative. It kills, it does that. Yes, it's true, but then I needed to send a message that tells the younger generation to stand up and fight. Hence, you will see the young male character on the right holding a spear, which is covered by a condom, which is the tool that we need to use to fight HIV and AIDS. And on the left, you see the red demon, which represents the virus itself in its final form. Beside it, you see the other little characters, which are the other forms of AIDS. So basically the message in that whole artwork is to encourage young Botswana to stand up and fight against this pandemic, because it's actually the biggest thing that's killing us as the people at the moment.
We as scientists, we have the way we communicate our messages to the public. We tell you guys to exercise, eat healthy, but you don't. So one of the things I've always recognized is the fact that perhaps our messages don't appeal to that core human nature or human need or human reason for change. And one of the reasons that's always been advanced is that the messaging can be very dry and bordering on boring. And so I just thought, well, if we're dealing with artists, we're collaborating with artists, they have ways of communicating which can be fun and more interesting. And therefore this would be an opportunity for us, because we want to raise awareness about high blood pressure. This would be a great opportunity for us to do that through different means.
Art in its own right is a powerful tool in engaging the people. It's very close to people and communities, because it's a manifestation of a certain tradition. As an artist in Africa and an artist in the British or in the UK rather, very different people. Because of their culture, they've got a way of putting that together. And art has that power of cutting across disciplines and digging out little grains of information in a unique way and putting it out there.
Since I was dealing with mental health, I had came up with this idea, this concept of a guy which symbolizes a person or anyone out there that can relate to it. First, I had shown a broken world that shows that that's his world, everything that means a lot to him. I showed a broken world, and this guy is floating outside this world, this blue guy. This blue means that this person is feeling sad, and on this person there's also like a hole on the chest. It means that they're feeling empty. That's like those are like some of the symptoms of somebody who's going through that anxiety and depression. On the picture again, I've shown this person holding a cigarette on the right hand, on the left hand, and on the right he's holding some pills, which means that other people out there find means to cope with their depressions and anxieties by smoking or either taking pills. And I've shown a smiley face like a mask, which means that some people just put on a smile on their face, hiding their depression. I think that's like a common thing with the depression. And anyway, that's some of the things we picked up from the residency. And lastly, I've shown this guy wearing some rocket shoes, like some shoes that's shooting out flames. That's just the simple way of saying that some people do uplift themselves because they are aware of the situation they're in. And just the last thing about the artwork, there's a sunflower type of thing at the top, which symbolizes the sun or nature, let me say. in that sense, I was trying to say that it's always good to interact with nature in a way, as it's good for health, mental health. Just taking your time, taking a breath, taking a walk, something. Yeah.
We're really fortunate in Botswana to have one of the very strongest treatment programs in the world. So if I had HIV, I would want to live in Botswana because we have over 600 public health facilities that you can get medications at. We're continuously optimizing treatment. So as I was saying before, going to Treatall, the use of integrase inhibitors, the use of dolutegravir, we're the first country in Africa on the continent to be able to provide really the best clinical care. And I think that's something that we have always strived for at the ministry, that we didn't want to have a double standard. We didn't want to see the West, the United States, Europe offer treatment that we couldn't offer also in Africa. And as a result of that, we have been able to maintain excellent clinical outcomes. So almost any health facility that you go into, you can test for HIV and you can get started on the medications, and you no longer have to wait until you're sick. And that's what Treatall is about. So as soon as you find out you're positive, you should go on treatment. So essentially, nobody ever needs to get sick from HIV again in this country. You just need to know what your status is. So I think, again, art projects like this are really important so that we can destigmatize this disease and see that treating HIV is like treating any chronic disease. And not that makes it okay to get HIV, but that people don't need to be afraid to test and know whether they're positive or not, so that we can actually protect the community.
For what I thought was just going to be a paint excursion, it was more of an educational excursion. So yeah, we got together. He told me that he wanted to bring artists and scientists together. I thought, whoa, how? So yeah, I mean, it was a mind-blowing experience, because I would have never imagined it would have turned out the way it did.
Well, first off, I think the mural was absolutely wonderful. I wonder, and perhaps maybe worry a bit of how many people actually get to see it and engage with it, because engagement, I think, sometimes requires dialogue. So I hope that people are brought to the mural and that discussions can take place and that the artists can interact with people that see the work. So, I mean, many people have told me, oh yeah, I've seen that mural in Malapo Crossing. And then we can talk about it and say, oh, actually, this artist came and stayed, and the dialogue begins. But I think it's really important for these kinds of community art projects to continuously engage the community. So not just to have an opening, but an ongoing series, and bring young people, bring kids, bring a busload of kids as an outing, so that they can see a mural and understand what mural is about, and then also talk about the subject matter. Actually,
I was in Karolinska Institute in Sweden about 2 weeks ago, and I was telling them about this project, and I was also telling, who else did I tell about this? Just how amazing it was to work with the artists and to actually see the depiction of, the messaging. We just tell people the message, but we never kind of follow them up and see how they conceptualize it. So to see it out there in a big wall was like, wow. So from what we were discussing, this is the take-home message. And it makes you reflect even more about how you talk to people about the science behind different diseases, including high blood pressure. So I was very impressed.
It was great. It was fun to gain a lot of experience from that. and I really wish to do it again. So that's what I would like to do.
Yeah, that was a new challenge, and I just feel like, yeah, I mean, it was a good 2.5 weeks of just painting.
While we're in the process, a lot of people came to us asking, what are you guys doing? They've never seen something like that. And we kept on engaging them to say, this is what we are doing, this is Acting Health for Impact, we're trying to do this, that. Yes, and it has already started provoking thoughts out there, and some people would come and claim to analyze, to analyze the artworks while it's still, before it gets finished. So someone will come and say, oh, that's the HIV, that's a virus. So what are those soldiers? What are they, So to me already, we have started achieving what we wanted to do, So the artworks, the installation part now, took about 5 days. Yeah, 5 days, day and night, working day and night. It was quite powerful, and the artworks in the final stage really pushed for dialogue on social media. People started taking selfies. We talked about it on the radio. We partnered with Duma FM to actually talk about it. So it's going on, and this is just a tiny thing, a pilot that we wanted to see if it can work. And I think with proper focus, with much more resources and investment into it, this would definitely build solidarity amongst young people in terms of through creating a certain unique content coming from science into art, giving the world something unique and giving the public something unique.